Welcome, everybody. We've still got some people joining in. Hosts, or panelists, you are good to start whenever you're ready.
Thank you. Buenos dias. Good afternoon, everyone. My name is Debra Flores, and I am the program director and assistant professor at the School of Health Professions with Texas Tech University Health Sciences Center in Lubbock, Texas. And I'm happy to be with you all today. I am also a certified community health worker instructor and have been for lots of years. I think my certification number is 22. So I'm kind of one of the first, proud of it. Today, Monica and I are going to talk to you about advantages of using an apprenticeship program to advance the CHW workforce. But before I go any further, I'll let Monica introduce herself.
Thank you, Debra. Good morning. Good afternoon, everyone. It's now afternoon. As Debra mentioned, my name is Monica Garcia, and I oversee our community health worker training program at the Larry Combes Community Health and Wellness Center, which is under Texas Tech University Health Sciences Center School of Nursing. I'm very happy to be here with you all today. Now I'll hand it back over to Debra.
All right. So we want to talk to you about an amazing program, apprenticeship program that Monica with the School of Nursing got funded. I got asked to collaborate with them because I started the CHW apprenticeship program. Monica, you want to advance? Thank you. So today we're going to talk about kind of the benefits of being an apprenticeship program and what that looks like. We'll give you, Monica was going to go over some examples on, what that kind of looks like. And then the benefit to the workforce, not only for the community health worker side of the workforce, but also the employer side. And so you'll be able to understand the process of how that works. So first of all, I can't see the chat room, but maybe you guys, there is a Q&A session too. I'm just wondering how many of you in the room have heard of an apprenticeship program? Oh yeah, there we go. Yeah, there's one. All right. Yeah, so, okay, two people. Not for CHWs, but yes. Okay. Yeah, so some of you have heard about this. So I'm glad that you have. So this isn't completely new to you, but perhaps this will give you some ideas on how to, enhance it or make it better. All right, next one, please. So just a little bit of introduction about apprenticeships. So these apprenticeships are actually administered at the federal level by the Department of Labor. And it combines on-the-job training, which is paid, with classroom instruction. And this is in order to prepare community health workers and others that are apprentices for highly skilled positions. It is supported very strongly by different sponsors, whoever the sponsor institution is, and Monica will go into that a little bit more later. But once a sponsor is able to host an apprentice, I think they have a great appreciation for what that looks like. So we have been a registered apprenticeship program since 2017. I am proud to say that I reached out to the Department of Labor back in 2015 and started the ball rolling to become an apprenticeship program. We were the first in the nation to ever get this up and running, and so we were able to establish a code for the CHW. They had never heard of a community health worker and what that looked like. So it took an extensive application process, but we did make it happen. And so in 2018, we were able to launch a pilot program to see how that apprenticeship was going to work. And it was very successful. We only had one apprentice at the time because we didn't have a grant like Monica was able to get, but that one apprenticeship program was successful. And actually, that apprentice who is now a certified community health worker is still working as a community health worker. And so using that leverage that we had, that we were already a certified program or a registered program, I should say, with the Department of Labor, then the School of Nursing was able to use that as leverage and obtain a HRSA grant in 2022. So here is what when you look up CHW apprenticeship program, this is what you're going to find in the Department of Labor website. And you can see the code for community health worker is right there. If you ever want to use it or want to look it up, it's something to be proud of, I think. And so anyway, next slide. So the benefits that I saw, when I first thought of applying is that it does transition a on-the-job training opportunity into good paying jobs. And it kind of serves as a testing period, kind of a, how you do a 90-day orientation with a new employer and they kind of testing you out. And so the apprenticeship program serves in that way for those sponsor organizations. So it helps the apprentice get into a good paying position if she's hired after she's done with her apprenticeship. And then it also helps the employers look up, where these apprenticeship opportunities are. And I'm not sure if there's another one in Texas. I haven't looked, to be honest. But employers are able to recruit, build, and retain this workforce, which is the community health worker workforce. When the apprenticeship, when the CHWs start an apprenticeship program, they are paid. Now, we are required by the Department of Labor to pay minimum wage, and that is the requirement during the training. Now, once the apprentice is over, they graduate, become certified, then the employer or the sponsor has the opportunity to hire them on, and then they are moved into a full-time salary type position. The sponsors or employers are committed to a 1-year employment. So for a whole year, that CHW, that's a student, is being trained and being paid on the job while receiving excellent opportunity for, gaining knowledge about the field and experience about the job that she's, taken. And so it is, it has, I think, established a foundation for full-time employment for community health workers in our area. Thank you, Monica. I'm so sorry. I started new medication for asthma and I have a sore throat. So we did have success in the program, as I mentioned. The community was introduced to the CHW apprenticeship. So we kind of were letting everybody know that we had this available to sponsors that wanted to perhaps sponsor an apprentice. And then the CHW workforce then was also introduced to the apprenticeship program. Now we use an application process when we started a cohort of community health workers and just the CHW training. We established an application process. So we had, at least in the pilot program, I think we had like 3 or 4 that had applied for the apprentice position. And so we vetted them. We went through the application process, which was, kind of rigorous because we wanted to make sure that this pilot was successful, that this student would be committed and available. And so we, went through this process and we selected one of the apprentice. Again, I think the registration with the Department of Labor laid the groundwork for more opportunities. And this particular person still continues 7 years later as a full-time community health worker. And I think she, from the last time I talked to her, she was very happy and was earning a very good salary as a community health worker. Did you require Yes, we had to require a background check for the one that was going into the apprenticeship with the sponsor. We did. And I'm not sure if Monica has had to with the ones that she's training now, but she can answer that question.
Yes, definitely. And what the part of the process that we've changed just a little is that we still have an application process for those that are interested in becoming an apprentice. And then once they indicate their interest, submit, do all of that paperwork and so forth, we then move them along to the actual employer. And then they have the opportunity to interview them. And if they identify that they're a good fit, then they start with that criminal background check as well as a drug screen.
All right, Monica, I think you're up now.
Okay. And so as Debra mentioned, that first apprentice that went through her program, her name is actually Antoinette Lewis. And Debra and I really thought that it would be a great idea to share some really authentic impact, right? Authentic information about what does this mean? What do these opportunities mean, and what do they lead to? And so I have a statement that I am going to read verbatim that I received from Miss Lewis. And so her statement is that I am Antoinette Lewis. I obtained my community health worker certification in 2018. I became a community health worker instructor in 2023. I found out about the community health worker certification program during a time in my life when I was really desperate to provide a better life for me and my children. I had graduated high school and went to school to become a medical assistant. Over the years, I was not able to gain employment in that field. I'd also successfully completed a phlebotomy certification prior to becoming a community health worker. However, I was still unable to obtain employment in that field as well. When I learned about the community health worker certification, I was very interested. The core competencies spoke to my heart. It was everything I'd always desired to be. A liaison for others, and especially individuals that might feel like their voice or concerns might be overlooked in the community. Although I was excited to learn more, I was still a bit hesitant if it would be worth my time or effort. As I started to gain more knowledge and understanding of each core competency and what that truly embodies for our community, I realized the work of community health workers is absolutely essential for individuals to successfully navigate quality healthcare and community resources. It aligned with my purpose. All of my life, I've wanted to be able to help others physically, mentally, spiritually, and emotionally, to inspire and empower others to want to live a healthier lifestyle that will hopefully lead to a longer, more productive life. I decided to take the course, and shortly after that, I was offered the opportunity to become a paid apprentice at the Texas Tech University Health Sciences Center through West Texas Area Health Education Center, written by Dr. Debra Flores. The knowledge and hands-on training, networking, and mentorship training that was invaluable. It's like I became a sponge. I wanted to soak up all of the learning, growth, and development that I could. I wanted to become the best community health worker and hopefully truly make a difference in the lives of others through providing education regarding chronic disease management, advocacy, or simply by providing a resource or referral. Through the community health worker program, I was able to successfully complete the community health worker training and the apprenticeship hours. And I was able to gain employment as a community health worker at a local county hospital, where I was able to start a lifestyle and diabetes prevention program, which I was able to teach and empower individuals chronic disease management, one-on-one health coaching, and addressing social determinants of health. I've done that for the past 5 years. I just recently obtained a position in the mental health field, providing education and outreach through the Texas Child Health Access through Telemedicine Program, better known as TCHAT, which is provided by Texas Tech University Health Sciences Center Department of Psychiatry. TCHAT provides access to counseling for school-aged children from kindergarten through 12th grade. Becoming a community health worker apprentice helped me to change the trajectory of my professional development. Becoming a community health worker helped me believe in myself again. The training and professional development I received was a light for me in a time that was truly a dark time in my life. I will forever be grateful for the time I spent as a community health worker apprentice, and also the trailblazers that continue to pour their time, energy, and heart into enhancing the skills necessary for growth and development for the community health worker workforce. Community health workers are truly essential in all areas, including but not limited to health and wellness, social drivers of health, mental health, and advocacy. I've been able to facilitate classes, speak at events, and create and teach curriculum for the Department of State Health Services and become a life coach, all because of the decision I made to become an apprentice. So I felt like that was really a powerful statement from Miss Lewis, and we could not be more proud of her. So we will move on, and I will talk to you all a little bit about the Community Health Worker Training Program. This is a HRSA funded project, and we did receive $2.4 million to provide community health worker training. And this is under the Bureau of Health Workforce, and the intention is to increase the community health worker workforce across the state. Well, actually across the United States, but of course we're working in Texas. And so something that was very unique about this particular project is that it allowed that collaboration across schools at Texas Tech University Health Sciences Center. As Debra mentioned, you know, this included her, and she falls under the School of Health Professions. Where we provide the training, of course, we're the Larry Combest Community Health and Wellness Center at T2HSC, and we fall under the School of Nursing. And then we also had some champions that were listed under the School of Medicine at T2HSC. And so this was a very different type of program and opportunity for us. So we were very excited to receive this funding. Under this funding, we committed to expansion, right? These are our objectives. In regard to expansion, we agreed to train 135 new community health workers. And so I'm happy to report that to date, we have trained 91, and we still have 1 year left of the program. And so in that year, we'll train about another 44 new community health workers. And when we say that they're new community health workers, we do have to, you know, put in the effort to look and make sure that they've not been certified before, since the state of Texas does have a certification process. So we have had a few that we've had to turn away because maybe they've let their certification lapse and so forth. But this opportunity is for new community health workers. And so what our core community health worker training includes is a 16-week course. I will say it is very rigorous. It is a hybrid course that is taught via Zoom, as well as in our learning management system. We use Canvas. And so 1 night per week, students join us via Zoom, and then they complete the rest of the coursework within Canvas within a limited time frame. And they're provided during this training, they will receive the 160 hours that's required by Texas Department of State Health Services. And then that particular training, the coursework equals up to about 10 hours per week. And because HRSA required that participants be involved for 40 hours per week, we had to implement a service learning requirement. And so those participants also have to participate for an additional 30 hours per week in a service learning opportunity. So this is a field placement, and which I'll talk to you a little bit more about this in just a moment, which is why we're all here, an apprenticeship placement. So this is just that boots on the ground training. This is where they can go and get that on the job learning and experience of being a community health worker. And then in regard to extending and upskilling, we committed to extending and upskilling 45 existing community health workers. And this will involve an additional 48 hours of training for those that choose to participate in this program. We have not offered this yet. We are planning to offer this part of the program this fall. And so what an already certified community health worker can expect with this piece of work is that they will receive training in public health essentials, public health emergency preparedness, transitional care coordination, mental health first aid, oral health modules, and whole health action management. Again, all of that additional knowledge and education will equal out to about 48 hours of certified continuing education for community health workers. And we will be offering that via a learning management system. So again, it'll be all online for them to participate in. And then the employment piece. And this is the apprenticeship piece that was implemented under this particular grant. And so we committed to 34 apprenticeship placements. And so some of the challenging pieces for this particular requirement of the grant is that none of the grant dollars were allowed to be shared or to go towards supporting any of those positions. And I think the reasoning behind that particular decision is that we wanted these positions to be sustainable moving forward. So it was required that those that were offering the apprenticeship positions and willing to be a part of that program, they definitely had to identify the funding for those positions, which would possibly allow for them to keep those positions at the end of the apprenticeship hours. And so let's talk a little bit more about apprenticeship. And so as Debra mentioned, T2HSC School of Nursing, well, originally it was under Debra over at AHEC, but we were able to transition that registered apprenticeship over to the T2HSC School of Nursing through the Department of Labor. And so the way the apprenticeship works for us is that we're able to add community-based organizations under our umbrella. So as long as the organization agreed to adhere to our standards of apprenticeship, and they were willing to sign, a memo indicating that they were willing to adhere to those standards, then they fall under us, and we oversee make sure that they're adhering to all of the standards and so forth. And so they just fall under the umbrella of T2HSC. Those apprenticeship positions, they do have to participate for 2,000 to 2,200 hours, and that related instruction is simultaneous. So they're receiving that community health worker core training while being in their placement at the apprenticeship site. And then once that's completed, then they still keep on with their apprenticeship positions. I'm happy to report that at startup, we started with 3 community-based organizations. The first one being Brownfield Regional Medical Center, which is in a rural area around Lubbock, Texas. And then we had the City of Lubbock Public Health Department and an organization called South Plains Community Action. They provide early education, Head Start education, and so forth across our area, which is called the South Plains. So some of the successes that we've had to this point is the fact that we have not had any particular challenges or issues establishing partnerships with community-based organizations. The majority of the time, these organizations have come to us and indicated their interest in partnering with us to receive, to have those apprenticeship positions, to start community health worker type programs and so forth. So the interest is there, which is wonderful. We were actually able to in the second year, that was in the first year. In the second year, we were actually able to add another apprenticeship site, which is in the city of Longview. This is somewhere that, I myself have never visited. They're over in East Texas. And so it was really exciting to be able to add them to the group. They have 2 apprenticeships currently in that area. And I think that another one of our successes, as we are just about to enter our 3rd year of the grant. It is a 3-year grant, but we have completed 3 apprentices from the first year. And I'm happy to report that all 3 of those apprentices were hired on full-time with benefits at their assigned organization. So that is a huge success. We do have 25 that are ongoing, 25 apprenticeship sites across these 3 sites currently. And so in our final year, we still need to secure 6 more. So we are working furiously to try to meet that committed number. I think that another, one of the most supportive things that we've received, the support that we've received is from our City of Lubbock Public Health Department. Those community health workers, apprentices that are assigned at that area are doing some fantastic work. And I actually have a statement, from the director of the Public Health Department, and she was able to speak a little bit about the impact that it has had on their public health department. And so some of the things that they've been able to do is transition folks that are at the front desk to participate and be involved in the training. And so this allows them to be more responsive to those clients, patients, community members that are coming in, and they're able to provide better services by linking individuals to community resources. They've also been able to extend one of their programs that's called Susan, and this is a substance use program. And so those teams have been able to grow tremendously. And so that leads to them being able to increase their capacity to serve individuals within the community. And then the final piece, which is brand new and, happening as we speak, which we're still waiting for this to launch, but it's in the works. They've had the positions posted, they're interviewing and so forth, but they are going to be offering a brand new, what they call an intermediary care clinic, which they will be serving patients that are coming out of the emergency room, hospitalized and so forth, and try to work as an intermediary between the hospital and making sure that they get established primary care somewhere. And that is going to employ 4 full-time community health workers working in that setting. So that is a huge success for the city of Lubbock, and we're very excited to be a part of that. Some of the challenges that we've encountered is, of course, number one thing when it comes to community health workers and other areas, of course, is funding. And so the apprenticeship does require that at the end of training that the apprentice receives a raise, right, if they're hired on full time. And so that has caused an issue. And then just simply identifying where they can pull this funding from in order to support the apprenticeship has been a challenge for some organizations that we visited with and haven't quite been able to partner with us at this point. Something that we're doing to address that is we're currently exploring some funding from Workforce Solutions that might be able to, they wouldn't be able to completely support or sustain those apprenticeship positions, but they can supplement about half is what I've been told. And so we are exploring that and hoping to be able to offer that in the future. Again, very often as we talk about these dollars, the grant money, the opportunities, I wanted to share with y'all today, again, authentic impact and what it really means when we say that we're training people to become community health workers. We're coordinating and facilitating apprentices throughout these different positions across the city. This young lady is Maritza Vasquez. She is one of the first apprentices that came through our particular program, and she's completed. And she's been hired on full time with our City of Lubbock Public Health Department. She's one of the ones that I mentioned, one of the 3. And she has just been amazing. It's just been amazing to watch her transform right before our eyes. I have also a statement from her that I am going to read verbatim because I think it's just wonderful to hear. So this is what she had to say about her participation in the apprenticeship program. Last year, before taking this program, I cleaned houses for a living and also would DoorDash for extra money. I happened to know a board member through volunteer work who told me, I think you'd be perfect for this certification course that is being offered. I didn't know what to expect, but I knew that I wanted something more for myself and my kids. I wanted to show them that there was more in life than living paycheck to paycheck. Starting class, I didn't even have a laptop. I used resources that were available, which is funny because it was a hint of what I do now daily for my clients. So I would check one out from the library every 2 weeks for 4 months. For my service hours, I was placed, for her apprenticeship, she was placed at the city's health department. And within 3 months, I was hired as a full-time employee. In just over a year, my life has completely changed. Now, if my kids get sick, I can take leave and not stress about the income I would have lost. We have life insurance. Not only has this greatly benefited my family, I've been able to also serve the community by helping my clients change their lives. There's no greater reward than knowing you gave someone hope just by giving them a ride to get a Social Security card or helped with interview clothes. I cannot put into words how grateful I am for the Community Health Worker Certification course and to Monica and Roxana for being such a great example for me. They are such strong and intelligent women. I'm glad to have had them as my instructors. I'm now in my 3rd semester in college working, excuse me, working on my degree in social work. Funny how one decision can change your life for the better. Thank you. I mean, it doesn't get much more impactful than that. But I have more. These again, if you notice, Maritza's in just about every one of these photos. But these are also some of the apprenticeship participants that are currently ongoing. So they just recently completed their community health worker training, and they're working on meeting that 2,000 to 2,200 hour for their apprenticeship requirements. The first one is Omar Jordan, and I like to highlight Omar because he's a male. You don't see that very often in the community health worker field, at least not here in Lubbock. And so we're really excited about his participation. But Omar, and he's over in this upper left corner here, he says that the apprenticeship program has helped me out a lot. It's made my experience as a community health worker go a lot easier, and I've learned lots of skills from the program that I incorporate into my work daily. My confidence working with clients is very high, and I feel like I have a lot of knowledge, and I owe it to the apprenticeship. Next, we have Jeanette Martinez. You see her, she's here in this street outreach photo with Maritza, and she's over here in this bottom right corner as well. And she's here in this graduation photo. This photo here was taken at our 2nd cohort's graduation, where we invited Maritza to be our guest speaker, and Jeanette's here on the right-hand side. And Jeanette says that I started my apprenticeship in October 2023 at the Lubbock Health Department in the substance use program, in the SUSAN program, which is the Substance Use Service Assistant Network. I'm very blessed to be a part of a program that has a team dedicated to helping the community. This apprenticeship has really changed my life, being that I myself struggled with addiction and never thought I would ever even be considered for a job working with the community. My experience in this program has given me another chance in life and the confidence to keep going. Wow, right? Wow. That is what these dollars are doing for those folks that are participating in this particular program. And then last but absolutely not least, I have another statement from Miss Michaela Cantu. Michaela again is here in this photo here in the green dress, the graduation photo. And then she's here in the middle on the bottom right. And Michaela says, I'm very grateful for the apprenticeship program. It's been a huge blessing in my life. Before I entered the program, I was employed at a place where I was underpaid and very unhappy. When the opportunity to leave was presented to me, I jumped. I now work in a place where I can personally make a difference in other people's lives. As a witness to the improvement in other people's lives, my mental health has improved, and I have grown to care for our community in a way I didn't realize was possible. Even my family has noticed a difference in my attitude and are happy that I'm thriving in a place I'm appreciated and truly matter. Through my current position, I have met key contacts and have been introduced to resources in the community that I otherwise would not have. I also have built relationships with people in the community that I previously wouldn't have even given a second thought to, if I'm being honest. Even though my current position is temporary, I have thoroughly enjoyed it and hope to possibly be employed permanently when or if a position becomes available. If that doesn't happen, I'm hopeful that the experience, education, and trainings I've completed here will benefit me in landing a high quality position in the future. hopefully in a place where I can better financially support my family while also being able to work in a field that truly makes a difference. I never saw myself working in this field, but the gratitude I have for this opportunity to better myself and the community is of great abundance. Thank you to Monica and Roxana for facilitating this program and encouraging us along the way. You both are true inspirations. And as you can see, they keep mentioning Roxana. She is the co-instructor for the community health worker training program. She's my right-hand person there. Say hi, Roxana, in the chat. And so anyhow, again, this is real life. This is the real impact that these types of programs can make, and the real impact that community health workers can make in their work. And this is a photo from our second cohort that completed earlier in February. I'm happy to report that, Debra originally, Dr. Flores originally started this program back in 2006. And from that date, we've had 20 cohorts of community health workers graduate. And so this is the third cohort under the HRSA CHWTP grant, and we'll be starting the fourth one in the fall. And I definitely have to mention that it would definitely not be possible if it was not for the support that we've received from the TTUHSC administrative. I call them CHW allies, because they are aggressive in their search for and in their writing for grants that support the work of community health workers, just like Dr. Flores has been doing for so many years. In this photo, you can see that we have the dean. She's here in the middle in red. She's the dean of the Texas Tech University Health Sciences Center School of Nursing, Dr. Holly Way. And then we also have the over here next to me, standing next to me, we have the executive director of the Larry Combest Community Health Awana Center, which is a federally qualified health center. That's Dr. Linda McMurray. And then also not pictured is Dr. Christina Esperat, who's the community health worker, the CH Foundation's Regents Professor in Rural Health Disparities and T2HSC School of Nursing. So without all of these community health worker allies, a lot of this work wouldn't be possible for this particular program. And we are so excited and happy to have them on our team and to be able to provide these services to the community and really make authentic impact. And, at this time, we're happy to answer questions. I do see that the chat's going off here, so we can visit the chat, or happy to answer any questions. This is also contact information for Dr. Flores and I. Let's see here.
There's a question, Monica. Why would they not supplement the full amount for Texas workforce?
I'm assuming funding issues. They require that the employer supplements half of that. I don't know that I have a better answer for you. Dr. Flores, do you have?
I know that in the past, they had limited amount of funds for apprentice type programs. And so I believe that's probably the correct assumption, Monica, is that the funding that they have would only stretch so far. So I'm guessing. I don't really know either. But
yeah.
But I also wanted to mention that I don't, as this apprenticeship program has evolved, it seems like especially what I've noticed most, I know Monica probably knows more than I do because she's more heavily involved, but these City of Lubbock Health Department seems to have really grasped the importance of community health workers. And they have, I think this intermediary clinic that they're starting came about because they saw the success that their apprenticeship program was having in the community. And so they have been working on it for a couple of years. I think since the School of Nursing got this grant, they've been working on this clinic, and I'm glad that it's about to come to full fruition. But I truly believe that the foundation for that came from the community health worker you know, as far as what they can do, what they're available to do. And so I'm very proud that that came about, and that they are so supportive. And so I'm thinking that as this, even after the funding ends next year, I'm hoping there'll be more employers that are bought in and reach out to Monica for apprentice so that they can also get involved and get you know, have this amazing workforce on their staff as well.
Mhm. Dr. Flores, I think you're absolutely correct. As I mentioned early on in the presentation, that collaboration across schools, I mentioned the School of Medicine. And so we have his name is Dr. Jamie Felberg, and he has been heavily involved in the grant process and making and delivering information about community health workers to other physicians in their different types of meetings and so forth. And so he's very supportive, and a lot of that came from their work in wanting to support the apprenticeship and so forth, and this grant. So yeah, it's been a work in progress since then. And so we're excited for those opportunities.
Yeah, he's been a real cheerleader and
Yes,
yeah,
very
just
much so.
advocate, huge advocate.
Uh-huh.
Vanessa wants to know if you provide consulting for other training centers in other areas to develop an apprenticeship program, or do you provide apprenticeship placement outside of West Texas?
So in regard to apprenticeship placements outside of, we can provide an apprenticeship placement anywhere in Texas, so long as we have a community-based organization that's willing to partner with us, as we did with Longview. As far as outside of Texas, we wouldn't be able to do that because of the Department of Labor regulation, rules and regulations, as well as our community. Texas does have a standardized process for certifying community health workers, and they do require that you be a resident of the state of Texas in order to apply for that. So that would make us, that would uphold us to serving the state of Texas only. But anywhere in the state of Texas, we're willing to look into that. And then as far as consulting goes, I myself do not provide any consulting. Even though we've made lots of progress, I do not feel like I'm an expert in the area. I'm still very much learning quite a bit about the process, but maybe Dr. Flores would be able to do that.
I was able to get the application to become an apprentice organization submitted. And I'm happy to share whatever information I can. And you have my contact information here, my email. If you want to reach out, I will do whatever I can to help you get started at least. And then perhaps you know, because I have that foundation to get the application started, and we got that approved. As far as the program that Monica has done, I have, you know, we started our own pilot program, and everybody's can be different, but I'm happy to help in whatever way I can, and you're welcome to contact me via email.
And I see that Ashley is asking, let's see here. We're having trouble with organizations finding the value in the registered apprenticeship route when students can bypass that process and enroll without agreeing to be an apprentice. Do you have any tips for avoiding that problem? Well, I think it's important for the organization to value the apprenticeship and what apprenticeship brings to the table. Like I mentioned the workforce solutions earlier, if funding is, probably funding is an issue. So if funding is an issue, I would definitely explore that that possibility in your areas, wherever you might be, Ashley. And Dr. Flores, do you have some additional input to offer there?
Well, you know, I think the apprenticeship offers a very solid foundation because it is registered with the Department of Labor. There are strict standards that we have to follow. And so meaning that these community health workers have to abide by these standards in order to be in the apprentice program, which means that if an employer or a sponsor hires this individual to be their apprentice, that they have this leverage that they can use, you know, that the apprentice has to meet all these standards. And I think that a lot of times, especially, you know, I've been doing this for 20 something years. And yes, CHWs can go right in and get their own jobs and stuff. But sometimes there's not a vetting process. There's not an opportunity to kind of try them out to see if they fit for that particular organization. And you know what happens is that that organization, it may be the first time that they hire a community health worker, and that community health worker just wasn't the right fit. And so what happens? They get a bad taste in their mouth, and then they don't want to hire anymore. And so I think with an apprenticeship program, you have more oversight, you have more structure. And therefore, if, for example, that particular apprentice didn't work out, they have the opportunity to try another one. You know, we put another one in their place. And so that gives them a little bit more flexibility to say, you know, this one didn't quite fit what we were needing. And sometimes personalities don't fit for a particular location. And so I think the apprenticeship provides that additional opportunity that other going straight into into an employee or employer won't give you. You can't trade out, you know. So I hope that helps.
Yes, I didn't think of that, Deborah, but you're absolutely right. Do you have a curriculum or guide for the workplace experience? We have the curriculum, of course, for the training, for the community health worker training. But really the workplace experience, the guide is really up to the employer. You know, they have to adhere to all policies and standards that employer has. And so it can vary. We do have standards, apprenticeship standards that have to be met, you know, what the expectations are and so forth, that Debra, you know, completed for the apprenticeship. However, that is just guidelines. They still, you know, all the apprentices still have to adhere to whatever organization, their own policies and standards and so forth. And it's been very interesting to see a lot of these programs are brand new. They're starting from scratch. And so that puts them in another position to be able to make sure things are flowing the way they'd like them to flow, and using those apprenticeship positions for that.
All right. Anyone else? I don't see any additional questions.
Okay.
Moderators, are we good?
Well, we thank everyone for your engagement during this particular session and for joining us.
Yes, thank you all so much. Y'all have a good rest of your training. Thank you, Monica.
Thank you, Dr. Flores.